Welcome to today's episode of Health University. And today I'm so excited to have with me a friend and colleague, Heather Gray. Heather is a functional diagnostic nutritionist and a bioenergetic practitioner, and she specializes in Lyme, mold toxicity, and autoimmune. And this is very much related to the fertility journey because especially in the air quotes unexplained infertility, if we just do a deeper dive, oftentimes we can find some mycotoxin infection or some low-grade chronic infection that this person has forgotten about for decades on end, and it is definitely implicated in her challenges to conceive and carry a healthy pregnancy. So welcome, Heather, and thank you for joining us today.
I'm so excited. And yes, air quotes. I love the way you said that. That's perfect.
Yeah. So would you mind by starting off telling the listening audience a little bit about yourself, your journey?
Yeah, absolutely.
Thanks.
So I usually start off at the beginning with, I was basically born full of shit, right?
Oh,
Like
yeah.
how many can you, oh my gosh, I'm having a little sleep issues. So I'm having word issues.
That's okay.
How many of you can relate, right, to being constipated as a young child? And that was like my first introduction to let's throw Band-Aids at symptoms, right? Let's give her thick, nasty oils. Let's give her stool softeners. But no one was trying to figure out why this 4-year-old couldn't poop. Hindsight's 2020. Turns out my uncle had committed suicide that year, and there was a lot of early childhood trauma.
Oh, my goodness.
And I'm pretty sure it kicked off my celiac. And so I'm eating the standard American diet, right? The SAD diet. I'm undiagnosed celiac. We've got early childhood trauma. So by the time that I got bit by a tick when I was 13, I was the perfect host. I was the perfect storm to be a good host. So when I did that, when I finally got diagnosed, I actually didn't start, when I got bit by a tick when I was 13, I actually didn't start developing symptoms till 2 years later with my first stint in the psych ward for a suicide attempt.
Oh, so it became mood lability issues. It was not the, joint aches or anything like that. So I want to put a pin in that for 1 second, because I really want the listening audience to hear that some of these classic stereotypical signs and symptoms, that's not all that there is. So, here you had this episode where your brain was the first to show it was affected.
Absolutely. And so a lot with any kind of virus, bacteria, autoimmune, it has a tendency to go after the weak link in the chain. And so I had said that I had celiac disease, which means I had a leaky gut. Because I had a leaky gut means I also had a leaky brain.
Yeah.
So my brain was already inflamed. And so it was the kind of the weak link in the chain. And yes, they say only 30% of people develop a bullseye rash. I did not develop a bullseye rash. The chronic widespread pain, the joint stuff did come later. But yes, I didn't present with, what people would normally think is Lyme. Then fast forward a few more years and finally got my diagnosis. It took 27 years for me to get diagnosed. Multiple stints in the psych ward for suicide attempts. 100 pounds overweight, mold toxicity, cavitations, and 3 autoimmune diseases later, I heard the founder of FDN speaking on a podcast, right, with John Croxton, Underground Wellness.
Yeah.
I was a silly hairstylist at the time. I didn't have a background in health, but hearing Reed speak on how you got to make sure your detox pathways are open and you got to look for other hidden infections and you got to make sure that your hormones are balanced and your gut is healed. Like it all made sense to me. Like intuitively, I was like, oh my God, that's it. That's
me.
That's what's going to happen. And when you do that program, you take a couple labs, on yourself, your first guinea pig. And, it turns out I had blastocystis hominis, which is another, common parasite, especially in folks who have pets. Right? Causes a lot of digestive issues. I had a liver that wasn't functioning properly. My hormones were in the dirt, so nothing was working properly, and it hadn't been for decades.
You must have felt horrible.
Oh, it was horrible. And it was sad because the reason that I went the functional route was because I'd already tried the Western med model for about 6 months, and all they did was throw napalm at a body that had been sick for decades. Remember how I said I couldn't shit? Well, I still wasn't pooping, right? You can't kill off a bunch of critters in a person who's not detoxing properly. I thought I was going to die.
Wow, I'm so sorry. And, just to dial back for one brief second, in Chinese medicine, my area of expertise, we have a direct link to grief and to the large intestine and lungs, the organs of detox, of letting go. And so it is, it is apparent to me that emotional trauma would have played a significant part. Just even as a small child, if you weren't experiencing it directly, you were living in an environment where, grief and trauma were clearly very present. So,
oh, absolutely. My parents were young.
mm-hmm.
They were addicts. They were extremely dysfunctional. So I don't even think they knew how to deal with their own grief with what they were experiencing, let alone help a 4-year-old,
right,
process her grief. And I remember me and my uncle being very, very close. He was young. He was around 17, 18 when he committed suicide. And I was 4, so he was like a big kid, He wasn't like the rest of the adults.
Yeah.
He would play with me.
Yeah.
And so, and I love that piece because that was one of the last pieces that I brought into my own healing journey was the mental emotional aspect to it. And that's really where a lot of the juicy healing begins.
Absolutely. In fact, I would say that the healing cannot be complete without adding this psycho-emotional and I'll say spiritual component, because it's all energy. Whatever we're manifesting in form and in function started as energy, is energy. We just need to sort of keep peeling those layers off and letting that energy dissipate into the healing and wholeness that we want to be.
Can I get an amen? Yeah. So I did the good functional thing, right? I was the good functional girl, and I would take my supplements, and I would, go do the diet. I was in bed by a certain period of time. Like I did all the functional things, and I kept relapsing.
Yeah.
And I would get better, and then I kept relapsing. And then there was, 4 things that I had to reevaluate. And so I work with my clients with that now is, you got to rule out mold. Because even the best protocol in the whole wide world is not going to do you beans a good if you're living in mold.
I got my ERMI test today in the mail today.
Fantastic.
So we'll be testing mold in this home.
The other one is cavitations. And so cavitation also can lead to fertility issues.
For the audience, explain cavitations, please. Thank you.
Yeah, so it's when they take out wisdom teeth or root canals the traditional way. A lot of times they leave something behind and it traps a bunch of icky, bacteria and viruses and all kinds of pathogens in your jaw. So if you think about it, it's so vascular there and it's so close to the brain. And so I had my wisdom teeth taken out when I was 13. So I had over 30 years of infection going on. So it scatters your troops. But then once they cut that open and they dug all that stuff out and sent it to pathology, I had several different viruses and bacteria that actually are linked to stillborns and miscarriages. And I had miscarried. So when you were talking about, hidden infections, like that was one that I think directly correlated to my first.
Yeah, when you talk about celiac and the gut barrier being also the brain barrier, well, guess what? It starts in the mouth. It is the tube. And that's some of the thinnest tissue as well. So it can cross at the mouth, it can cross in the gums right into the bloodstream. And it sounds as though yours was actually imprisoned in your tissues. So it could only go into the bloodstream. It had no way to escape until they
absolutely
made it an exit route for you. Wow.
And that's a heck of a lot more common than people think. That's why I said I have people rule out mold, cavitations, and the third one is sleep apnea, because if we're not getting enough oxygen to our brain at night, again, the best supplements, the best diet, the best, all of it is not going to do you beans a good. But then that last piece that I dialed in was the trauma piece, right? It was the resetting the nervous system. It was finally addressing all the trauma, not just the early childhood trauma, but the trauma of toxins and the trauma of infections and the trauma of, autoimmune disease. Like it all piles up on the nervous system, keeps you stuck in that fight or flight, right? Where you can't heal.
Absolutely. Absolutely. It's interesting. A couple of weeks ago, I had Dr. Tony Ingram on the podcast, and she's a dentist. And the whole conversation was about the importance of recognizing how oral health is completely in line with and can be an impediment to one's fertile health.
Oh, 110%. Some of my favorite guests on my show have been biological dentists because the correlation is just insane. And there's so many people who are not taking care of their oral health, and it all starts here.
Yep. Yep. With, as you say, with breathing, with just letting it's the first area of entry. So whether it's food, water, or whatever we're putting in, or just air, if it's dirty, if it's moldy, then that's where it's going to enter. So that's fascinating. I've also had Dr. Irene Kopp when you talk about the trauma connection, and Dr. Amy Apigian, and so the importance of not just speaking to trauma, not just identifying that yes we had it, but having methods to release and heal from that trauma is important. How did you find this to be of service to you?
So I started off with the book, The Body Keeps Score. Whoa, horribly traumatic and triggering. Like, oh my gosh, I'm ugly crying on the couch, and my husband's like, what are you reading? I'm like, this little girl and her dad, and he's like, never mind. But it brought in to, all the different things that we can do. Like, it taught me, some plant medicine. So I started off with ayahuasca, actually, and processed 41 years of mother shit in one night. Thought I was going to die. Very, very intense.
Well, you probably did, but it was an ego death.
And then I've
had the good fortune as well of being in the rainforest and having some of the most efficient cleansings. So yes, I'm a big proponent of, for the right person, setting, need to be, taken care of. Be a very efficient way to just really kind of exterminate some of this trauma.
Well, that's kind of my MO. I'm like, oh, I need to do this. Then I go to the biggest, baddest. Let's like laser, right? Let's cut this out. And then so I've done 2 psilocybin journeys. I've done 2 Bufo journeys. And then
what
now
is Bufo?
So it's actually right up there in alignment with ayahuasca. It's a frog medicine.
It's
not Kumbo. It's a different type of frog medicine, but yeah. And then recently I'm on low dose ketamine as well. So, and then I actually learned from Dr. Amy Apigian. I went through her somatic experiencing work. That absolutely changed my life. And then breath work, right? Cold plunges, all these different things, bioenergetic work, being, all the things. And I still have to do them on a regular basis, because the minute I start to feel myself slide and get back into, right, that constant fight or flight. Yeah. That's when all my symptoms start to come back. Like, I've put Lyme in remission 3 years ago. I've reversed 2 autoimmune diseases. I've lost 100. I no longer think about suicide. And it's because I keep my immune system and my nervous system humming along at optimal level, right? Because the minute I let either one of those slide, I backslide very quickly.
Right. And I would like to just clarify for the listening audience that you don't have to do all the things. Just, find the things that work for you. If prayer works for you, if drumming works for you, if walks in nature work for you, if, just disciplined breathing work for you, and please breathe. No matter what else you're doing, please breathe. What we're talking about are just, some of the more recent, advances to how to get on the fast train, if you will, to healing. But you're also very astute in that, when that autoimmune switch is flipped, it's on. I mean, it's you don't cure, but you can forever be in remission. Right. Because that's the nature of autoimmune. So it is a discipline, right? It's just like life. It's a discipline. And so we can get ourselves well enough to go, a little sideways. But those of us with autoimmune are going to get we have a recognition of, oh, I know that symptom, and really try to find that symptom for yourself, because the sooner you can course correct, the easier the getting back to homeostasis will be.
Absolutely. And not everybody is the canary in the coal mine. I have genetics that make me more susceptible. People talk about a detox bucket. I have a detox thimble. So it does not take much for me to get out of balance. And it sucked for the longest time. I was like, it's not fair, watching people around me drink and eat stuff and stay up late and just be people. And at the end of the day, I'm grateful. I've come to peace with, my path is different. And this is the road I have to walk to stay healthy. And thank God, because I've met people that even doing some of these things, they're still not operating at a level that I am. Right. So I'm grateful for my path, and I no longer, the FOMO is gone. It's, now when I see that kind of cake or those alcoholic beverages, I imagine it with like police tape wrapped around it, right?
Huh.
Like
Oh.
it's no longer tempting to me because I know how bad I'm going to pay for it.
Right.
And so I just don't. But it took me a while to get there. That didn't happen overnight. And so having a little grace for yourself, right, when you're in
Absolutely.
the process.
Absolutely. Back to the fertility side of things. Did you find yourself having sort of disruptions in your menstrual cycles? Did you have any of the, sort of the kinds of symptoms that we have learned by our modern culture to brush off, painful menstruation, PMS, well, obviously you had changes to your digestive system 24/7, 365, but, maybe worsening, during, just before your period or something like that. Tell us about how this affected your fertile health.
Oh my gosh. If I would have known then what I know now, I would not have let them do a hysterectomy in 2020.
Partial or?
Partial.
Okay.
Yeah. A severe endometriosis that had probably been there my whole dang life. Like my one ovary was glued down to my uterus and the tissue was just almost everywhere. I mean, from an early age, I can remember being horribly painful, heavy. I was severely anemic for the majority of my life and didn't even realize that was part of it. I know it was absolutely horrific. Like, it's not supposed to be that way, right? It really is not supposed to be that bad. And I would say something and then, I'd kind of get gaslitted, like a lot of us do, right? It's all in your head. It's just part of being a woman, blah, blah, blah. Suck it up, buttercup.
Yeah. Yeah.
And then, my miscarriage. And that was absolutely heartbreaking. I wasn't trying to get pregnant at the time, but by the time I came around to being okay with being pregnant, to then lose it was just absolutely heartbreaking.
Of course. And that conversation is obviously pertinent today in these, like in current media. I think that not enough attention and care is being given to, what happens to a person when miscarriage occurs. There tends to be the diagnosis, the reason, and we'll go try again, or, go adopt, or, donor egg or things like that. But what's missing is attention to the trauma. Yeah.
Oh, absolutely. And I had to have a DNC done because my body wasn't expelling it on its own. And I remember laying in bed the next couple of days, trying to, recover from that procedure. And it was like nothing happened. Everybody just kind of brushed over it and, oh, you're back to normal. Oh, you're back up. And it was bizarre. And it was funny that stuff comes up when I've been doing this plant medicine. There's been a few times the energy of that baby loss has come up. And it's not something I've even thought about in 19 years. Like I totally forgot that happened to me. But that's been a lot of my MO. If something traumatic happens, we kick dirt over it, we move on,
Pandora's box.
We think we bury it until it comes out in 3 different autoimmune diseases.
Yeah. Yeah. And I'm painfully happy for you because those are your emotions that were able to get dislodged, if you will. They like endometriosis, they were able to get unstuck. The adherence to being, I'm okay, everything's okay, I'm just going to move on with my life, got enough of a pause where you can look at these moments in life, and it is life, for God's sake, that we're supposed to be able to look at these moments. We're not also only supposed to be, skipping through the daisies with unicorns by our side. Life has trauma and pain, and we need to give that its honoring as well.
Amen. The biggest thing in, I'm a very spiritual person, and especially I live close to Boulder, Colorado, which is kind of a hippy dippy capital. I love it. And there's a huge movement of some spiritual bypassing, and it's so dangerous because God gave us these emotions for a reason, not to just bypass them, but to sit with them and find out what they're trying to teach us. Like they're beautiful. It's a beautiful gift, but no, especially as women, right? We're taught, we're allowed to express this and we're allowed to express this and anything else in between, then we're a bitch, or we're bossy, or we're, all the above, or
whiny, or
crazy. Yeah. So, yeah.
And yet, in Chinese medicine, I have that preface with almost all of my patients to clients. In Chinese medicine, the very fact of engaging with the emotions here again, just like the body, so that the energetics of that can move. It just wants to move, so that if it's too much accumulated, it can dissipate. If there's not enough, it can accumulate, so that we have a good balance. And when we don't give it that due, we lose the opportunity that for wisdom, because all of those emotions are giving us a pearl of wisdom that is part of our, I'm going to say DNA, because I do think it is our DNA. It influences our DNA.
Absolutely.
Yeah, we need to come up with another NA word, an SNA, a spiritual DNA, or something like that, because it imprints us, and therefore imprints our future selves, like you having this conversation, relationship with the child you lost 19 years ago. That was a DNA imprint of sorts.
Oh, no, for sure. Absolutely.
Yeah. So listeners, I think that for me, the takeaway here is either allow when emotions come up to give them their sacred space, and find time to invite them, because I'm going to bet there's not a listener out there who hasn't had some experience that they have just, buttoned down so that they could, play nice and get along and be accepted, whatever the environment is. So give it some sacred space.
Absolutely. Yeah, especially, women in business, it's not always appropriate to cry or, appropriate to express some of these things, but to tell your body it's okay. I will give you space later, right? That it absolutely allows that opportunity to happen, instead of it getting stuck in your body and then coming out sideways later on, because that's what'll happen, whether it's through your reactionary or, through a disease, like it's going to come out some way or another.
And gosh, I could go down this conversation for the duration, but I want to give the audience some conversation around the how to know that we should consider, is Lyme or mold or any of the other hidden toxins, mycotoxins or biotoxins, a possibility in a fertility journey. What would you have someone think about? Like, do you have XYZ? Are you noticing ABC? And then what would be some of your strategies for either proving it with functional medicine testing and or addressing it with treatments?
Yeah, a lot of it's people being, going to different practitioners. If you've been to over 20 different practitioners and you've gotten no answers, that's probably a good sign to look into something like that. Or you've had all the blood work done and they told you that you're normal. That's another, flag on the play. Chronic widespread pain. So, migrating pain. Migrating pain only has there's only 6 diseases in the whole disease book of migrating pain, and Lyme is one of them. So, and it sounds like a hypochondriac, one day it's my right shoulder, the next day it's my left elbow. It could be Lyme disease. Brain fog, allergies, right? Allergies, especially like asthma type stuff, really can be linked to mold. So just if you've got more of symptomology that's longer probably than a list of 5, that might be another thing to look into, right? And then, working with somebody who can help you tease all these pieces apart, So I like doing, before even running a lab, I like doing these 2 intake forms they're intense, but they're really great about teasing out, is it mold? Is it Lyme? Is it co-infections? Is it heavy metals? Is it parasites? So that way we're not wasting a bunch of money on labs that we possibly don't need, right?
I feel so much the same way, Heather. I cringe a little bit when people come in with their stack of labs, and I think, oh, first of all, there's no way you needed all of these labs, because the right lab would have ruled out what you needed. And secondly, any lab is only as good as its second lab to see how did the treatment go. So now you're doubling up on all of that expense as well, and all the supplementation and so forth. So yes, so your intake, and that's here again, the old way of doing things is to listen, ask good questions and listen. They will tell you what direction to go if we listen to them. Yeah.
I love putting the pieces of the puzzle together. That's one of my superpowers, is being able to see a whole picture. Because Lyme patients especially, they've had to be their own health advocate for so long that they come to me very sophisticated for the most part. They've already gone gluten-free. They've already tried this. They've already tried that. But sometimes what they've done is like there's one piece that's out of order, right? Or maybe they're just missing a little corner piece to help put the whole thing together. But that's one thing that I really love to do is to take the whole picture, take a step back and go, okay, I see what you did here. And, maybe we need to go back and do this, or have you considered this, type of thing.
Yeah.
But yeah, so starting with somebody who, listens, has a really thorough intake form, who's not going to, order $5,000 worth of labs right off the bat, unless that's what you do, right? I've had some people that are like, I want to rule out Lyme and I want to see it in black and white and here's the money. Absolutely. We'll do that.
Well, and especially if they have an environment or a history, if they know they've been bitten by a tick, if they're, riding horses, as part of their either work or play, then it makes sense to that could have happened. But when you just start with some obscure symptoms and then go down the path of I'm going to check, all of these things, I think it's helpful to just check sequentially, rule out, because you might rule in and just then be able to roll up your sleeves and do the deep dive.
Oh, absolutely. I get clients that get so frustrated. They kind of fatalist. I've already seen 20 practitioners and I can't see another one. And I'm like, how awesome. Look at all the things you ruled out, right? Like just taking a mind shift, right? And switching that around. Next, because sometimes that's, sadly, we've put doctors on pedestals for so long. And at the end of the day, one, they're still human. And two, they didn't get a lot of training in the world of nutrition, mental health, chemical and biological toxins, like all the things that are making people sick these days. And so, if first you don't succeed, try again. That next practitioner could be the one who can tie it all up together.
Right. Yeah. Don't give up. Don't give up. Do you have experience specifically in or any testimonial or memory of a person just having had her reproductive health transformed, where she had either PMS or she thought she was going into early perimenopause or any of the things where?
Oh, absolutely.
Yeah. Let's hear.
Yeah, I had a young girl. Gosh, she was probably 24, 25 on birth control, having to take like muscle relaxants and other heavy duty stuff on that time of her month. Her periods were irregular. The pain was horrible. And then she was starting to have some other, symptoms start to happen. So it started off with, menstrual issues, and it started migrating out.
Yeah.
And then once we cleaned up her diet, once we made her detox pathways, once we balanced her hormones, literally within like a month and a half. That's all it took.
Wow.
She was a hairstylist, so she was working around a lot of toxins. I was an ex-hairstylist, so I know that world all too well. So just taking a few of those burdens off her body, and then her body, especially being so young.
I was just going to say yes.
Yeah.
She had vitality on her side.
Oh, absolutely. Like it turned around so fast, it was ridiculous.
Beautiful. Well, and here's hoping that she then took her story into the salon and into her circle of hairstylist friends, because hairstyling and nails and some of the other sort of certain esthetician-ish procedures, these people who are having to sit there amidst those chemicals day in, day out without circulation. I mean, I think that they probably were the luckiest when they had to mask.
Yeah, right.
Because it was protecting their bronchial pathways and their blood. So, well, that's a great story. Any others come to mind?
Not specifically to fertility, because the majority of the people I work with are in their 40s, mid 40s, who are burnout, executive types that have hit a wall. And so they're not looking. That's the last thing they're thinking about.
It's true. And those who are thinking about it are running to the IVF center because they know time is not on their side, and they're correct. Time is not on their side. However, doing some of these cleanups can really help improve their outcomes if they go to IVF. They don't have to then go through 3, 4, 5 egg retrieval cycles. They could get it down to 1 or 2 because it's quality at that point, not quantity.
Quality, exactly, on the type of baby you're going to give birth to as well, because just because you can doesn't always mean that you should. And we're seeing a huge, spike in autism and ADHD and childhood diabetes, and a lot of them has to do with these toxins and these hidden infections that we're talking about. So absolutely, you should think about cleaning both you and your partner up before, going to look at the IV route. And then a lot of times you don't even need it.
Mm-hmm. Mm-hmm. Yeah. Well, that's my world. So I would say if they're in their 40s, and want to have, a child or more, they probably should consider it, but they really should be considering either simultaneously, or if even as a couple of months of being able to do the cleanup beforehand, it will make a difference. Because as you just demonstrated with the 20-year-old, the body wants to heal and it will do the best that it can. So yeah.
Absolutely.
Yeah. Is there anything that I haven't asked that you want to say, Susan? This is like the key point, and you haven't even asked the question, because you know what you know, and I don't know what you know.
No, I usually just start off with people as no matter how common a symptom may be is never normal, right? It is always your body's check engine light coming on, saying there is something going on in here. And so instead of taking some over-the-counter thing, putting a piece of tape over that check engine light, dig deeper.
Is there a way that people can dig deeper with you? Do you work across state lines? And how can people, well, who do you want to say, if this is resonating with you, then come see me, and how can they get in touch with you?
Absolutely. Yeah, I work with folks, usually between ages 35 and 65 who, like I said, have done everything. Nobody's listening to them. They don't feel like they're getting heard or getting the results that they need. Somebody who might suspect Lyme or mold or autoimmune. Mm-hmm. And yes, I work remotely. You can go to the lymeboss.com. That's Lyme, not Lyme as we're making margaritas. And so there's, I've got my course up there. There's a free quiz up there. Is it Lyme disease? There's so much awesome free information up on my website.
Excellent. And it'll be in the show notes, people. So just look below for links, because yeah, you're right. Like the quiz alone can help be one of the differentiating factors of, is it Lyme or is it parasite, or is it something else? So that's great. Well, I really want to thank you for your time today. It was fantastic. And I hope I get to have you back, because as I said, we could have had an entire hour on the subject of shaman. And I use that term in its most revered and sacred way, because whether one can be a devout Christian, Muslim, Buddhist, Jew, and it is shamanism that is the alchemical transformational process that happens for us all when we want to heal through our spirit. So absolutely. I think that that's kind of a fun way to end the conversation. So listeners, thank you for listening. We look forward to seeing you at the next episode of Health University.